Hello everybody, my name's Sharon McNally. I'm the Director of Nursing, Midwifery and Allied Health Professionals and also the Deputy Chief Executive. I'm stepping in this week to do Lance's digital diary and I'm absolutely delighted to introduce Seyi Akinlaja to you, who is our first consultant midwife in the organisation. You'll be aware that the Nursing and Midwifery and Allied Health Professional strategy absolutely is embedded in driving different roles in the organisation. And the consultant role and Seyi's role is the first role they've introduced as a consultant level. So I'm going to have a chat with you today, Seyi, just so people understand what your role is about. So a really warm welcome. I'm absolutely delighted that you've joined us.
Thank you for having me.
Where have you come from?
So I have come directly from the North East London local maternity system. So I used to work there as a senior project manager on the transformation plan for workforce and education, and also for midwifery continuity of care. And prior to that, I was an educator for over 4 years, where I worked as a practice experience facilitator within the nursing corporate team at an NHS organization. And then the last 3 years before that, I worked as a lecturer practitioner in midwifery at an NHS trust and also at the London University. And prior to that, I used to work as a nurse and a midwife.
Wow, what a massive amount of experience. We're
Thank you.
really grateful and to benefit from that. So there's all that experience. What motivates you every day still?
Well, it's about, so my main motivation is about wanting to give the best to our women, to our clients. As we all know, maternity is out there for the negative reasons, but the positive aspect of it is that on reflection, back in the days, maternity was not on the main agenda of the government, but now in the last, 6 years, we have been out there for negative reasons, but it has helped to transform that care, and we're still within that transformation. And those are the things that motivates me, wanting to give the best not only to my clients and their relatives, but also to be able to be a role model to our workforce, to encourage them. Pandemic has hit not only maternity but the NHS very badly, and we've seen an increase in mental health. So being providing that pastoral care as well for all our staff, and also reassuring them that okay, if I can get here, you can also do it. And also listening, as we're listening to our patients, we're also listening to our staff. So being that transformational leader really is one of the things that motivates me, because I really want the maternity care to transform, and not just maternity care as a whole, but at Princess Alexandra, changing the narrative for our clients and also for our staff.
Gosh, I really hear that absolute drive to make a difference and make an improvement, which is just brilliant and music to my ears. So lots of people, because it's a new role, won't understand what a consultant midwife or a consultant nurse or a consultant practitioner does, and it's quite a prescribed role, isn't it? So could you just talk to us about what your 4 pillars of your role are that make a consultant role?
So consultant midwifery and also a consultant nurse is to provide that leadership for the workforce and also for the women. So the 4 pillars of the consultant midwife or consultant nursing is, first of all, providing the expert midwifery care or expert nursing care, and being strategic in the role as well, working closely with the maternity leadership in shaping the care that we provide. Secondly, as a consultant midwife, I am here to provide the professional leadership and also consultancy, not only to our staff but also to women, ensuring that women are well listened to and we're able to change the narrative for them and their relatives. And thirdly, as a consultant midwife, I am here to provide the education So is the third pillar is education and training. So working collaboratively with the education team and the clinical governance. So in doing that, we're embedding our learning from serious incidents and audits into our training. And then fourthly, it is about research, quality improvement, and service evaluation. So, and I know one of the main agenda of Princess Alessandra is involving our midwives and nursing into research. And one of my main priority is to start the journal club, and I'm happy to say that will be starting on the 25th
Brilliant.
of this month, and hopefully we'll be able to have not only research midwives but also research nurses as well within the trust.
Brilliant. So it's quite a big role, isn't it?
Yes, it is.
And, I'm absolutely delighted, because what I really want to do, and I know we've had conversations, and is around the consultant roles, really bringing together the collective voice of the specialist nurses, midwives and AHPs across the organisation. It gives us an amazing opportunity. And as you say, to really drive that evidence-based and research practice across our profession. So it's just an absolute win-win for us, an absolute must-do. And I wonder if you might finish. So your job is really broad, isn't it? In terms of your professional practice, your patient load within maternity services, where's your area of focus and why?
So my area of focus, because as a consultant midwife, I am the consultant midwife for midwifery-led care and public health. So, and that means I am working with women and also the multidisciplinary team in ensuring that we listen actively to our women. So, for example, with our birth reflection clinic, so a lot of women have had sometimes could have gone through traumatic birth. So listening to them and see how we can make it better for them and not discourage them from having babies again. And also we have the VBAC clinic. So that VBAC means vaginal birth after cesarean section. So many women have a cesarean section before the national guideline, and also our local guideline here supports that women can still have vaginal birth, but in ensuring that we keep up the safety, and also support our staff to be able to care for the woman in a safe space, and also the birth option. So as I will be the one leading on this clinic, but also working collaboratively, not only with the obstetrician, but also other members of the multidisciplinary team, and working with the specialist midwives with our national agenda in ensuring that we have our reports ready, and we're embedding the national recommendation into the care that we provide.
Yeah. That's brilliant. And as you started, there's such a lot of really bad stuff out there, isn't there, in the press around some of the really, really difficult read reports that we've had around maternity services. And so to have you as part of our maternity team in terms of that constant drive for improvement, making sure we hear the voice of the people that access our services and making sure we use that to drive improvement is just amazing. So really, really delighted that you've joined us, Seyi. Really, really look forward to continuing to work with you.
Thank you.
Just a massive thank you for your time today.
Thank you for having me. I look forward to working with you all. Thank you.